Let's begin. Question 1. A 68-year-old male with COPD presents with increasing shortness of breath, productive cough, and fatigue. ABG, pH 7.31, PaCO2 56 mm of mercury, HCO3 29 milliequivalent/L. Which nursing action is most appropriate? A. Increase oxygen to 6 liters per minute. B. Place patient in high Fowler's position and assess breath sounds. C. Encourage fluid restriction. D. Administer sodium bicarbonate. Answer: B. Place patient in high Fowler's position and assess breath sounds. Rationale: the ABG indicates respiratory acidosis with metabolic compensation. Increasing oxygen excessively may suppress the hypoxic drive in COPD patients. The most appropriate action is to maximize ventilation through positioning and assess lung sounds. Strategy: when a COPD patient presents with worsening gas exchange, first support ventilation and assess before adjusting oxygen flow. Question 2. A 35-year-old postpartum client is found diaphoretic and confused with a blood glucose of 38 mg per deciliter. She is NPO for an upcoming test. What should the nurse do first? A. Administer 50% dextrose for push. B. Notify the physician. C. Recheck blood glucose in 15 minutes. D. Give orange juice. Answer: A. Administer 50% dextrose for push. Rationale: this client is experiencing severe hypoglycemia with altered mental status and cannot take oral glucose. 4-dextrose provides rapid correction. Strategy: for hypoglycemia with altered consciousness or NPO status, always use 4-dextrose as the first-line intervention. Question 3. A client with heart failure receiving 4-furosemide complains of muscle cramps, irregular pulse, and the ECG shows flat T waves. Which electrolyte imbalance is suspected, and what should be done immediately? A. Hyperkalemia, administer insulin. B. Hypokalemia, notify provider and anticipate potassium replacement. C. Hypercalcemia, increase fluids. D. Hyponatremia, restrict fluids. Answer: B. Hypokalemia, notify provider and anticipate potassium replacement. Rationale: furosemide promotes potassium loss. Symptoms of hypokalemia include muscle weakness, irregular pulse, and ECG changes such as flattened T waves. Potassium replacement is required to prevent arrhythmias. Strategy: always link loop diuretics to potassium loss and cardiac arrhythmia risk. Question 4. A patient with diabetic ketoacidosis, DKA, is on an insulin infusion. The nurse observes that glucose dropped from 420 mg per deciliter to 110 mg per deciliter in 1 hour. What is the next best action? A. Stop insulin immediately. B. Decrease insulin rate and start D5 ns. C. Continue insulin at same rate. D. Give glucagon IM. Answer: B. Decrease insulin rate and start D5 ns. Rationale: a rapid drop in glucose can lead to cerebral edema. The insulin should be tapered, and dextrose should be added when glucose approaches 250 mg per deciliter to prevent hypoglycemia and stabilize osmotic changes. Strategy: in DKA management, glucose should decrease gradually, not more than 100 mg per deciliter per hour. Question 5. A 72-year-old client with pneumonia is confused, tachypneic, and restless. Which assessment finding requires immediate action? A. Oxygen saturation 91% on 2L nasal cannula. B. Temperature 38.8 degrees Celsius 101.8 degrees Fahrenheit. C. New onset confusion and agitation. D. Blood pressure 128/80 mmHg. Answer: C. New onset confusion and agitation. Rationale: in older adults, acute confusion is often an early sign of hypoxia. Prompt assessment and oxygen therapy are necessary. Strategy: prioritize neurological changes as indicators of impaired oxygenation in geriatric clients. Question 6. A postoperative patient suddenly reports chest pain, dyspnea, and anxiety. O2 saturation is 84%, RR30, HR118. What should the nurse do first? A. Notify the physician. B. Increase oxygen and place in high Fowler's position. C. Assess for leg swelling. D. Prepare for chest X-ray. Answer: B. Increase oxygen and place in high Fowler's position. Rationale: these are signs of a possible pulmonary embolism. The nurse should first promote oxygenation by increasing oxygen flow and improving ventilation through positioning. Strategy: in acute respiratory distress, apply the ABCs, airway and breathing before contacting the provider. Question 7. A client with cirrhosis has ascites and confusion. Labs show ammonia 98 mol/L and potassium 3.1 milliequivalent/L. Which medication order should the nurse question? A. Lactulose. B. Furosemide. C. Spironolactone. D. Potassium chloride. Answer: B. Furosemide. Rationale: furosemide causes further potassium loss, worsening hypokalemia and hepatic encephalopathy. Spironolactone is preferred for ascites because it spares potassium. Strategy: in liver disease with low potassium, avoid loop diuretics and favor potassium-sparing ones. Question 8. A 25-year-old trauma patient is receiving 4 fluids rapidly. Suddenly, the client develops dyspnea, frothy sputum, and crackles in both lungs. What is the nurse's priority action? A. Slow 4 fluids. B. Increase fluids to maintain BP. C. Administer bronchodilator. D. Place in Trendelenburg position. Answer: A. Slow 4 fluids. Rationale: the symptoms indicate fluid overload leading to pulmonary edema. The immediate intervention is to reduce or stop the infusion. Strategy: when acute shortness of breath follows fluid administration, suspect overload and slow the infusion first. Question 9. A patient with rheumatoid arthritis taking prednisone reports sudden weight gain and swelling. Which lab finding supports this concern? A. Sodium 150 milliequivalent/L. B. Potassium 4.2 milliequivalent/L. C. Glucose 90 mg per deciliter. D. Calcium 8.8 mg per deciliter. Answer: A. Sodium 150 milliequivalent/L. Rationale: corticosteroids cause sodium and water retention leading to fluid overload. Elevated sodium confirms this side effect. Strategy: prednisone commonly causes increased sodium, glucose, and decreased potassium. Always check electrolytes in chronic use. Question 10. A patient with acute pancreatitis reports severe abdominal pain after eating fatty foods. Which nursing intervention has the highest priority? A. Provide small, frequent high-protein meals. B. Keep NPO and insert nasogastric tube. C. Encourage ambulation. D. Administer oral antacids. Answer: B. Keep NPO and insert nasogastric tube. Rationale: pancreatitis pain is triggered by food intake due to enzyme secretion. NPO status and NG decompression reduce pancreatic stimulation. Strategy: when a patient with pancreatitis experiences pain after meals, think rest the pancreas, NPO. Question 11. A client with thyroid storm has HR 152, temperature 40 degrees Celsius 104 degrees Fahrenheit, and BP 180/88. What is the priority action? A. Administer acetaminophen. B. Administer propranolol. C. Administer levothyroxine. D. Prepare for tracheostomy. Answer: B. Administer propranolol. Rationale: propranolol reduces sympathetic symptoms like tachycardia and prevents cardiovascular collapse in thyroid storm. Strategy: in thyroid crisis, control heart rate and temperature first before addressing hormone levels. Question 12. A patient with acute kidney injury on 4 fluids now has crackles, distended neck veins, and shortness of breath. What should the nurse do first? A. Slow the infusion rate. B. Document and monitor. C. Encourage fluids. D. Check urine-specific gravity. Answer: A. Slow the infusion rate. Rationale: these are classic signs of fluid overload. The immediate response is to stop or slow the flow rate to prevent pulmonary edema. Strategy: in renal impairment, assess for volume overload frequently, act immediately when fluid retention signs appear. Question 13. A 78-year-old client with Alzheimer's is found wandering outside the unit. Which nursing intervention is best to prevent recurrence? A. Apply wrist restraints. B. Increase sedatives. C. Use motion sensor alarms and reorient frequently. D. Lock the unit doors. Answer: C. Use motion sensor alarms and reorient frequently. Rationale: safety devices like bed or door alarms are less restrictive and promote dignity. Frequent reorientation supports cognition. Strategy: always choose the least restrictive yet effective intervention for confused clients. Question 14. A patient receiving chemotherapy reports burning at the fore site. The nurse notices redness and swelling. What should be done first? A. Flush with saline. B. Stop the infusion immediately. C. Apply warm compress. D. Notify provider after completing infusion. Answer: B. Stop the infusion immediately. Rationale: this is a sign of extravasation. The infusion should be stopped to prevent tissue damage, and the provider notified immediately. Strategy: pain or swelling at an fore site during chemotherapy means stop the drug first, do not flush. Question 15. A post-thyroidectomy patient suddenly develops hoarseness, stridor, and difficulty breathing. What is the immediate action? A. Check for bleeding at the site. B. Prepare for emergency tracheostomy. C. Apply oxygen. D. Reposition head. Answer: B. Prepare for emergency tracheostomy. Rationale: hoarseness and stridor indicate airway obstruction from laryngeal edema or hematoma. Immediate airway management is required. Strategy: after thyroid surgery, airway takes priority, be ready with emergency tracheostomy equipment at bedside. Question 16. A 45-year-old male with end-stage renal disease presents with muscle twitching and a positive Chvostek's sign. Which laboratory value would the nurse expect? A. Potassium 5.9 milliequivalent/L. B. Sodium 140 milliequivalent/L. C. Calcium 6.8 milligrams per deciliter. D. Magnesium 2.0 milligrams per deciliter. Answer: C. Calcium 6.8 milligrams per deciliter. Rationale: hypocalcemia causes neuromuscular irritability leading to tetany and positive Chvostek's sign. Chronic kidney disease decreases vitamin D activation, reducing calcium absorption. Strategy: for renal patients, always think low calcium, high phosphate. Link twitching to hypocalcemia. Question 17. A 33-year-old female on lithium for bipolar disorder presents with vomiting, tremors, and confusion. Which lab value confirms the nurse's suspicion? A. Lithium 0.8 milliequivalent/L. B. Lithium 2.3 milliequivalent/L. C. Sodium 140 milliequivalent/L. D. Potassium 4.0 milliequivalent/L. Answer: B. Lithium 2.3 milliequivalent/L. Rationale: therapeutic lithium level is 0.6 to 1.2 milliequivalent/L. Toxicity causes tremors, confusion, and GI distress. Dehydration and low sodium worsen toxicity. Strategy: always correlate lithium toxicity with dehydration or diuretic use. Draw level before next dose. Question 18. A patient with ulcerative colitis has severe diarrhea and reports dizziness. BP 88/54 mmHg, HR 120. What is the nurse's priority? A. Administer anti-diarrheal medication. B. Start 4 fluids as prescribed. C. Encourage oral intake. D. Place on bed rest. Answer: B. Start 4 fluids as prescribed. Rationale: signs indicate hypovolemia from fluid loss. Rehydration prevents shock and renal failure. Strategy: GI fluid loss, treat circulation first, ABCs = C. Question 19. A 68-year-old post-stroke patient aspirates while eating. Which nursing action is most appropriate to prevent recurrence? A. Place patient flat after meals. B. Offer thin liquids. C. Position in high fowlers during meals and 30 minutes after. D. Encourage large bites. Answer: C. Position in high fowlers during meals and 30 minutes after. Rationale: upright positioning reduces aspiration risk in dysphagic patients. Strategy: stroke, think, swallow, safety, upright posture, small bites, chin tuck if needed. Question 20. A client receiving total parenteral nutrition, TPN, suddenly develops diaphoresis and shakiness. What is the nurse's best initial action? A. Stop TPN immediately. B. Check blood glucose. C. Call provider. D. Increase infusion rate. Answer: B. Check blood glucose. Rationale: hypoglycemia can occur if TPN rate changes or if infusion stops abruptly. Verify glucose before other actions. Strategy: sudden change during TPN, check glucose first, then act. Question 21. A 56-year-old diabetic client reports numbness in feet and cannot feel temperature changes. Which complication is the nurse most concerned about? A. Peripheral vascular disease. B. Neuropathic ulcer formation. C. Cataracts. D. Diabetic ketoacidosis. Answer: B. Neuropathic ulcer formation. Rationale: sensory neuropathy leads to unnoticed foot injuries that become ulcers and infections. Strategy: always link numb feet plus diabetes neuropathy skin breakdown prevention. Question 22. A 70-year-old with chronic atrial fibrillation is prescribed warfarin. Which finding requires immediate attention? A. 1.8 Indian rupees. B. 2.4 Indian rupees. C. 4.8 Indian rupees. D. 2 Indian rupees. Answer: C. 4.8 Indian rupees. Rationale: therapeutic INR equals 2 to 3 for atrial fibrillation. An INR 4 indicates bleeding risk. Strategy: high INR, hold dose plus notify provider. Question 23. A 25-year-old trauma patient develops petechiae, oozing from 4 sites, and prolonged PT/PTT. Which condition should the nurse suspect? A. Disseminated intravascular coagulation, DIC. B. Thrombocytosis. C. Hemophilia A. D. Polycythemia vera. Answer: A. Disseminated intravascular coagulation, DIC. Rationale: DIC causes widespread clotting followed by bleeding due to clotting factor depletion. Strategy: in trauma or sepsis plus bleeding everywhere, think DIC. Question 24. A postoperative client with a nasogastric tube has a sudden drop in urine output from 60 milliliters per hour to 15 milliliters per hour. What should the nurse do first? A. Check for kinks in the Foley catheter. B. Increase 4 fluids. C. Notify provider. D. Document as expected. Answer: A. Check for kinks in the Foley catheter. Rationale: always assess equipment and mechanical causes before assuming physiological failure. Strategy: check first, call later. Verify lines, tubes, and drains before escalating. Question 25. A patient with myasthenia gravis complains of sudden muscle weakness after receiving medication. Which medication error is most likely? A. Missed dose of anticholinesterase. B. Overdose of anticholinesterase. C. Missed steroid dose. D. Missed antibiotic dose. Answer: B. Overdose of anticholinesterase. Rationale: overdose leads to cholinergic crisis, muscle weakness, respiratory failure. Strategy: weakness after med could be toxicity, hold dose, support airway, check atropine availability. If you're enjoying this video so far, like and subscribe. Welcome back. Question 26. A 60-year-old client on heparin for DVT suddenly complains of abdominal pain and has a drop in blood pressure. What should the nurse do first? A. Stop heparin infusion. B. Increase infusion rate. C. Administer another bolus. D. Elevate legs. Answer: A. Stop heparin infusion. Rationale: sudden hypotension and pain indicate internal bleeding. Stopping heparin prevents further hemorrhage. Strategy: unexplained hypotension on anticoagulant, stop drug, assess, notify provider. Question 27. A patient with pneumonia develops a new productive cough with rusty sputum. What action should the nurse take first? A. Collect sputum sample for culture. B. Start prescribed antibiotics. C. Increase 4 fluids. D. Administer cough suppressant. Answer: A. Collect sputum sample for culture. Rationale: sputum must be collected before antibiotics to identify causative organism. Strategy: culture before cure, always obtain cultures prior to antimicrobial therapy. Question 28. A patient with type 2 diabetes presents with fruity breath, Kussmaul respirations, and glucose 520 mg per deciliter. Which 4 fluids should the nurse anticipate first? A. D5W. B. 0.9% normal saline. C. D5 1/2 normal saline. D. Lactated ringers with dextrose. Answer: B. 0.9% normal saline. Rationale: initial therapy for DKA is isotonic saline to restore perfusion before switching to dextrose solutions. Strategy: DKA treatment, order fluids, then insulin, then electrolytes. Question 29. A 70-year-old COPD patient becomes drowsy after receiving morphine for dyspnea. What should the nurse do first? A. Assess respiratory rate and depth. B. Call rapid response. C. Give naloxone immediately. D. Document findings. Answer: A. Assess respiratory rate and depth. Rationale: the nurse must confirm hypoventilation before giving naloxone or escalating. Strategy: always assess before acting, verify cause of sedation. Question 30. A 28-year-old pregnant client reports severe right upper quadrant pain and nausea at 34 weeks. BP 168/102 mmHg, proteinuria 3+. Which complication should the nurse suspect? A. Placenta previa. B. Preeclampsia. C. Ectopic pregnancy. D. Hyperemesis gravidarum. Answer: B. Preeclampsia. Rationale: hypertension, proteinuria, and epigastric pain indicate liver involvement in preeclampsia. Strategy: pregnancy plus hypertension plus RUQ pain preeclampsia until proven otherwise. Question 31. A client with Addison's disease suddenly collapses. BP 70/40 mmHg, weak pulse, and confusion. Which medication should the nurse anticipate? A. Insulin. B. Hydrocortisone 4. C. Furosemide. D. Potassium chloride. Answer: B. Hydrocortisone 4. Rationale: Addisonian crisis results from cortisol deficiency leading to shock. Immediate steroid replacement is life-saving. Strategy: crisis cortisol. Always prepare hydrocortisone for adrenal crisis. Question 32. A patient with Parkinson's disease takes levodopa/carbidopa. Which statement indicates understanding of the therapy? A. I can stop the medication when my tremor improves. B. I will change positions slowly to avoid dizziness. C. I should take it with high-protein meals. D. If my urine is dark, I'll call the doctor immediately. Answer: B. I will change positions slowly to avoid dizziness. Rationale: orthostatic hypotension is a common side effect. High-protein meals interfere with absorption. Strategy: for levodopa, remember hypotension, dyskinesia, and protein interaction. Question 33. A burn patient develops urine output less than 30 milliliters per hour, rising potassium, and confusion. Which phase of burn injury is this? A. Emergent, fluid shift, phase. B. Acute, diuretic, phase. C. Rehabilitation phase. D. Resolution phase. Answer: A. Emergent, fluid shift, phase. Rationale: during the emergent phase, fluid shifts into tissues causing decreased output and hyperkalemia. Strategy: Early burns, fluid loss, high K, later phase diuresis, low K. Question 34. A 58-year-old with cirrhosis vomits blood and becomes hypotensive. What should the nurse do first? A. Insert NG tube. B. Administer vasopressin as ordered. C. Position client in side-lying position. D. Obtain vital signs and call rapid response. Answer: D. Obtain vital signs and call rapid response. Rationale: hematemesis and hypotension indicate variceal bleeding, a medical emergency. Rapid stabilization is critical. Strategy: ABCs and hemodynamic stabilization take precedence in GI bleed. Question 35. A patient receiving blood transfusion developed chills, fever, and back pain within 15 minutes. What is the priority action? A. Slow the infusion. B. Stop transfusion and keep 4-line open with saline. C. Give acetaminophen and continue. D. Notify lab after transfusion completes. Answer: B. Stop transfusion and keep 4-line open with saline. Rationale: these are signs of an acute hemolytic reaction. Stopping transfusion prevents further antigen exposure. Strategy: transfusion reaction, stop blood, maintain 4 access, save bag for investigation. Question 36. A patient in diabetic hyperosmolar state, HHS, is lethargic with glucose 850 mg per deciliter, normal ketones. Which is the most important initial nursing action? A. Begin insulin drip. B. Start large volume 4 fluids. C. Insert Foley catheter. D. Check urine ketones. Answer: B. Start large volume 4 fluids. Rationale: dehydration is profound in HHS. Fluids take priority before insulin. Strategy: compare DKA versus HHS, both need fluids first, insulin second. Question 37. A 45-year-old patient with Guillain-Barré syndrome reports shortness of breath. Which assessment finding requires immediate action? A. BP 110/68 mmHg. B. Vital capacity less than 15 milliliters per kilogram. C. Weak grip strength. D. Absent deep tendon reflexes. Answer: B. Vital capacity less than 15 milliliters per kilogram. Rationale: low vital capacity signals impending respiratory failure, prepare for intubation. Strategy: in neuromuscular disease, monitor vital capacity closely, it guides ventilation decisions. Question 38. A patient on digoxin complains of nausea, blurred vision, and seeing yellow halos. Which lab value supports this finding? A. Digoxin 1 nanogram per milliliter. B. Digoxin 2.8 nanograms per milliliter. C. Potassium 4.0 milliequivalent/L. D. Calcium 9.5 milligrams per deciliter. Answer: B. Digoxin 2.8 nanograms per milliliter. Rationale: therapeutic level equals 0.5 to 2 nanograms per milliliter. Toxicity causes GI and visual disturbances. Strategy: digoxin plus low K toxicity risk, always assess potassium and drug level. Question 39. A patient with COPD has an O2 saturation of 88% on room air. Which order should the nurse question? A. Oxygen 2L via nasal cannula. B. High flow oxygen at 10 liters per minute. C. Teach pursed lip breathing. D. Encourage fluid intake. Answer: B. High flow oxygen at 10 liters per minute. Rationale: high oxygen may suppress hypoxic respiratory drive in chronic CO2 retainers. Strategy: COPD, keep O2 low, 1 to 2L, titrate slowly. Question 40. A 40-year-old male with peptic ulcer disease suddenly develops severe abdominal pain, rigid abdomen, and absent bowel sounds. What is the nurse's first action? A. Insert NG tube. B. Notify provider. C. Administer antacid. D. Offer clear fluids. Answer: B. Notify provider. Rationale: these are signs of perforation, requiring emergency surgery. Strategy: sudden severe pain plus board-like abdomen equals perforation, surgical emergency. Question 41. A patient with septic shock has BP 78/40 seconds despite fluids. Which medication should the nurse anticipate? A. Dopamine infusion. B. Furosemide 4. C. Nitroglycerin drip. D. Morphine sulfate. Answer: A. Dopamine infusion. Rationale: dopamine improves cardiac output and blood pressure through vasoconstriction in septic shock unresponsive to fluids. Strategy: shock unresponsive to fluids vasopressors. Question 42. A 66-year-old post-cab patient has chest tube drainage of 200 milliliters in 1 hour. What should the nurse do? A. Continue to monitor. B. Milk the tubing. C. Notify surgeon immediately. D. Clamp the tube. Answer: C. Notify surgeon immediately. Rationale: drainage greater than 150 milliliters per hour indicates possible hemorrhage requiring surgical evaluation. Strategy: chest tube drainage guidelines: sudden equals bleed, sudden equals obstruction. Question 43. A client with SIAD has serum sodium 118 milliequivalent/L. Which nursing intervention is most appropriate? A. Encourage oral fluids. B. Restrict fluids and monitor neurostatus. C. Administer hypotonic force solution. D. Provide salt-free diet. Answer: B. Restrict fluids and monitor neurostatus. Rationale: in SIADH, excess ADH causes dilutional hyponatremia. Fluid restriction corrects sodium safely. Strategy: SIAD salt is actually diluted here. Restrict fluids, not give more. Question 44. A patient with newly diagnosed HIV has a CD4 count of 180 cells/mm superscript 3. Which intervention has the highest priority? A. Administer routine vaccines. B. Begin prophylaxis for pneumocystis jirovecii. C. Encourage daily exercise. D. Provide iron supplements. Answer: B. Begin prophylaxis for pneumocystis jirovecii. Rationale: CD4 less than 200 risk of opportunistic infection, start trimethoprim sulfamethoxazole prophylaxis. Strategy: memorize CD4 thresholds, less than 200 start PCP prophylaxis. Question 45. A 52-year-old on chemotherapy develops a WBC of 1/200/mm superscript 3. Which instruction is most appropriate? A. Avoid fresh fruits and flowers. B. Limit rest periods. C. Use crowds to increase immunity. D. Stop chemotherapy immediately. Answer: A. Avoid fresh fruits and flowers. Rationale: neutropenia increases infection risk, avoid sources of bacteria and fungi. Strategy: neutropenic no germs. Enforce strict asepsis. Question 46. A 63-year-old patient after hip surgery reports sudden shortness of breath and chest pain. The nurse notes tachycardia and low oxygen saturation. What is the priority nursing action? A. Administer prescribed morphine. B. Elevate the head of the bed and apply oxygen. C. Encourage deep breathing and coughing. D. Notify the provider after 30 minutes of monitoring. Answer: B. Elevate the head of the bed and apply oxygen. Rationale: these are classic signs of a pulmonary embolism, PE, sudden dyspnea, chest pain, tachycardia, and hypoxemia. The first priority is to support oxygenation and prevent further hypoxia. Strategy: when a post-op patient suddenly becomes short of breath, always suspect PE. Prioritize oxygen, position, and rapid notification. Question 47. A 72-year-old client with heart failure presents with confusion, weakness, and irregular pulse. The ECG shows ventricular ectopy. Lab results: K 2.6 milliequivalent/L, NA 138 milliequivalent/L. What is the nurse's best action? A. Restrict fluids. B. Notify the provider and prepare to administer potassium. C. Document and continue monitoring. D. Encourage ambulation. Answer: B. Notify the provider and prepare to administer potassium. Rationale: severe hypokalemia, K less than 3.0, can cause life-threatening arrhythmias, especially in cardiac patients. Replacement must begin promptly, usually 4 with continuous ECG monitoring. Strategy: low potassium plus irregular rhythm equals cardiac emergency. Never ignore abnormal K. Question 48. A 34-year-old patient in labor is receiving an oxytocin infusion. The nurse observes contractions occurring every 90 seconds, each lasting 80 seconds, and fetal heart rate deceleration to 90 bpm. What is the first nursing intervention? A. Stop the oxytocin infusion. B. Increase 4 fluids. C. Apply oxygen via non-rebreather mask. D. Notify provider after 10 minutes. Answer: A. Stop the oxytocin infusion. Rationale: the findings indicate uterine hyperstimulation with fetal distress. Stopping oxytocin prevents further uterine contractions and improves fetal oxygenation. Strategy: in fetal distress with oxytocin, stop, turn, oxygen, notify. Keycap 1 stop oxytocin. Keycap 2 turn patient on side. Keycap 3 oxygen. Keycap 4 notify provider. Question 49. A 58-year-old diabetic client is scheduled for surgery at 8 a.m. and received insulin glargine the night before. At 6:30 a.m., blood glucose is 70 mg per deciliter, and the client feels dizzy. What should the nurse do first? A. Administer scheduled morning insulin. B. Give 4 ounces of orange juice. C. Notify the anesthesiologist. D. Recheck glucose in 2 hours. Answer: B. Give 4 ounces of orange juice. Rationale: hypoglycemia, less than 70 mg per deciliter, must be treated immediately with fast-acting carbohydrates if the client is awake and alert. Strategy: before surgery treat hypoglycemia immediately, then notify anesthesia. Never delay treatment for mild low sugar. Question 50. A 67-year-old client admitted with pneumonia develops confusion, restlessness, and a PaO2 of 52 mm of mercury on ABG. What is the nurse's priority action? A. Increase oxygen flow rate. B. Assess airway and prepare for intubation. C. Recheck pulse oximetry. D. Administer prescribed antibiotic. Answer: B. Assess airway and prepare for intubation. Rationale: PaO2 less than 60 mm of mercury indicates severe hypoxemia. Confusion shows cerebral hypoxia. Airway and ventilation support take priority before antibiotics. Strategy: always apply ABCs, airway, breathing, circulation. When oxygenation is critical, intubation preparation supersedes all other actions. And that wraps up our 50 toughest NCLEX case study questions, designed to push your clinical reasoning to the limit. Now tell me in the comments, how many did you get correct? And which one made you think the hardest? Don't forget to like, subscribe, and hit that bell so you won't miss the next NCLEX challenge. See you in the next one, where we make nursing mastery simple.